Dr. Coletti, Baywest Health Rehab. Today I am with Martin. Say hello, Martin.
Hello.
Martin is a 35-year young man who has always complained a lot of some lower back discomfort and neck discomfort. He found us on YouTube, all of my YouTubers, with the Manipuflex procedure. In fact, he was watching whom I call the Godfather, Dr. Johnson, out of is it Houston, Texas area. And then he found us, and then so he's here today, and we're here in Pasco County, Florida, so maybe about a half hour from Tampa. So we're going to get the procedure with him today for the first time, and without further ado, let's get you on your belly, Martin, okay? There we go, get you. He's also got some lower back discomfort, as you know, he's got some bones up here that are. But he's never been on this table. Have you ever had any kind of flexion distraction like this before?
No, sir.
Okay. Alright, so we're just going to stretch him out a little bit. Are you relatively comfortable in this position?
I am.
Very good. I always say relatively because no one's really in perfect comfort, especially on this table, because like I always say, being here in our clinic, in our office, though we may help a lot of patients, it's not a country club. And we're not here to baby you. So right here, we're going to just really open Martin up. He's got a lot of wedging at that last two bones in his lower back, L4-5, L5-S1. Breathe through the nose and out your mouth. Can you handle that?
Sure.
And just relax. That's there. Okay, and then we're going to just do a little polishing off here. Now, Martin, when I have a patient for the first time, just communicate with me. If something's bugging you or bothering you or pinching you, let me know. Okay? Or scream. We don't want any screaming. I have to edit that part. But I don't edit any of my videos. So let me ask you, Martin, how long were you watching us in the Manipuflex procedure online before you finally kind of bit the bullet and cold?
It was probably 3 months.
3 months.
3 months.
You're not nervous, are you?
No, sir.
Whereas Martin doesn't look like a guy who gets nervous about much, but I'll tell you that. All right, just relax. Remember, as it gets to that farthest point of the stretch is when I want you to slowly exhale. Now, so many patients love this, what we call the genie rub. And they ask, really, what does it do? And it just loosens up the tissue, gets everything kind of just relaxed. But therapeutically, not a whole lot. But anything to make a patient feel better, feel good, is good. Not everything. Yeah, careful how I say that. But just, the body, at the end of the day, wants to move. And this is a conversation I have with so many of my patients, is that, a lot of patients with half a brain on their shoulder, they know what they should do. They know that they should get proper rest. That they know they should exercise to some degree. They know they should have a proper diet. They know they should have a proper attitude. They know they should see their chiropractor to make sure their nervous system is in balance to the best of their ability with some type of moderation. But we are humans, and humans are by nature we lack discipline. So my job here is to never tell a patient what they don't already know, but it's to call them out a little bit. To say, hey, how bad do you want to feel better? Or how bad do you want to see results? Breathe. Or how bad do you want to feel better? For example, Martin here is 35 years young. Being a guy that's about 10 years older than him, it doesn't get easier when you get older. So this is a good time, especially if you're in your 30s and you're having some discomforts in the neck and the back region, musculoskeletally. Make a pact to yourself. Get up and move, stretch, exercise, but don't try to do too much, too quick, too fast, because what I find is if patients kind of, you know, it's March now, almost at the end of the first quarter of 2018, patients, you know, they get this big hi-ho new diet in the beginning of January, exercise, and they burn out. You know, I tell patients, if you're not working out, work out twice a week for a half hour and do that for 3 months. Because A, if you can't do that, you can't do it. But if you can do a half hour twice a week for 3 months, then you've kind of created a little baseline, a little foundation to then maybe you kind of increase that one more day. It's not as difficult. And then if you do screw up, you go back to twice a week at 30 minutes a day. That's pretty good. Breathe. Is that too much?
No, that's perfect.
Okay, good. Relax, relax. Just let your body go to jello for me, okay? And again, like I said, this is really gonna, with most of our patients with lower back issues, all the muscles in their lower back, especially like we've got a grade, he's got about a grade 1.5 spondylolisthesis at L4, 5, and 5S1. So all those muscles in the back there are just so tight. And for those of you that don't know what that fancy word is, I just said it's what I call just forward or anterior slippage of the vertebra on the very back. Relax. And this is that hip that you had a little more swelling and inflammation in.
Yeah.
This is probably why you can feel it right there. And relax. We're going to do a little jump work. Checking out the legs. He's got a very high left pelvis up here. Shorten the right. Loose. Relax. That was your ankle. And okay. And breathe for me. Good. Relax. Good. Loose. You know, to all my chiropractors that follow, if you can swing over here and just show them the mirror over here that we have. This isn't so I can look and see how handsome or lack thereof of good looks that I have, but as a chiropractor, a lot of our life and work is about ergonomics. I sit over my table all day, so this helps me to fight to sit up straighter. Okay, we don't want to double blind them with the mirror, but that's a really good idea to have. That makes the room look a little bigger if your adjustment room is smaller. Breathe through the nose, out the mouth. Loose and relax. Let this kind of go. Good. Doing okay, Martin?
Yes, sir.
Good. Okay, arms to the floor for me. And I want you to breathe for me. Let it out. Good. Breathe in. I want to hear you. And then let it out all the way out. Good. 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 There we go. Oh my gosh. All right, now we're going to have you slowly flip over on your back. It might be easier if you come off the table, and then we're going to have you lay down on your back. So now with Martin, you can see we opened up his entire lower back lumbar spine with a little flexion distraction, spinal decompression. Now what we're gonna do is, we open up his lower mid-dorsals. How did that feel in your mid-back there? That moved pretty good.
Yes, sir.
Legs up for me briefly, and down. Good. And just relax. This is gonna help us to flatten out his lower lumbar lordosis in his back. And then we're going to strap him in. Are you relatively, again, comfortable, Martin?
Yes, sir.
Okay. And just relax. Yeah, I'll strap it, then you can put your hands down for me. Okay. And again, if you've seen this video 100 times, you kind of have an idea of what's going on. All right, just relax. And again, compared to with Dr. Johnson, he likes to use the specialized table.
Yeah.
This does just as well. Now with the hands under the butt, as far as you can, because it helps to just really relax those shoulders. Got it? Okay. All right. And this is one touch that Dr. Johnson, I don't know if he does use the warm towel or not. Head up and down. Good. Good. Just relax. I'm actually gonna double up with this one. Head up and down. Good. Perfect. All right. But first, before I do that, I'm just going to stretch you a little bit, okay? And just relax. All the way loose. Good. And yeah, get those hands under so you're relatively comfortable. Good stretch. Good. All right. And can you breathe? Mm-hmm. All right. And I just want you to relax for me all the way loose. Breathe. And let it go all the way. Good. Good. Ah.
Wow.
You okay?
Oh my gosh.
Okay, relax. Almost done. That's what we call a yasi, I believe. Let it fall. Let it go. Let it go. Let it go. All the way. Oh, loose, loose. Let it go. Good. All right. Okay. How far down did you feel that?
Wow. All the way to my
All the way down through the lower shoulder blades?
Yeah.
Have you ever had that move like that before?
No.
At any chiropractor you've ever been to?
No.
Can you feel your fingers?
Yeah.
All right, we got a thumbs up. Martin, Dr. Coletti, Baywest Health Rehab, Manipuflex. We're out.